While doing posterior approach, you can do olecranon osteotomy. It's a chevron osteotomy with apex distal through the bare area. Prior to doing the osteotomy, do a drill, tap the screw. When doing osteotomy, you can use a saw, but finish with osteotome. Fresh blade to avoid necrosis. Fix with a partial threaded screw, cancellous screw, or a tension band wire. There is a Gerben approach, that is lateral head of the tricep and intermuscular septum. The tricep has 3 heads. Long head is arising from the infraglenoid tubercle of scapula. Lateral head is posterior surface of the humerus, superior to the radial groove. Medial head is posterior surface of humerus, inferior to the radial groove. Avulsion injuries can happen to spheroid, quinolones, and renal disease. Recent studies have shown that tricep sparing approach is better than splitting approach. Olecranon osteotomy shown complication of 36%, reoperation of 14%.